CIPHA is a British care system platform digitally connecting health, social care and community organisations, enabling shared care, population health intelligence and coordinated neighbourhood-based care.
Before the connected care record, we always had feedback from patients like, do you not know this already? Why is this not on my record? We were literally flying blind.
We needed to have much better live data to manage the health of our patients.
As one of the country's biggest care system platforms, CIPHA collects clinical data from more than 2,000 organisations and currently holds 20 billion records for 17 million patients.
All of the data that we're collecting follows the patient across their whole patient care, so from a GP to an ambulance service to an acute hospital, so that any services can see things about you that were recorded in a different place.
Clinicians and social care professionals can both share information but also create information for other colleagues across the system.
In areas where CIPHA is deployed, all types of professionals are finding new ways to improve their services.
I can see who needs to see us urgently, and in that way I create more capacity for the people that most need it.
We can look up their latest scans, we can look up their latest blood test results, we can look up what happened when they saw the mental health team, so everyone, including ambulance services, can see at 3 o'clock in the morning what their needs are.
We can access the shared record from the patient's home, so we can see recent results they've had, double check their prescribed medications versus what they're taking. We can see what's happening elsewhere across the system and make sure that our care is really joined up for the patient, and it just makes our job a lot easier.
What this has allowed us to do is to create a metaphorical roundabout, and we have the patient in the middle and the healthcare team surrounding them can use those records to give the patient continuity of care.
The difference it's made has been enormous in that we all cross each other's paths, but we're no longer treading on each other's toes.
The CIPHA data also provides population health, allowing local and regional care services to drive service improvements. Using the CIPHA care system platform, they can plan care, predict patient decline and target support to avoid crisis, thereby reducing hospital admissions, cutting waiting lists and improving population health by addressing health issues earlier and more proactively.
CIPHA changes the conversation from what happened to what is happening and how actually we can prevent things from happening in the future.
It's the ecosystem that we need to move into proactive care.
It's a game changer to be able to use data from different places because you can deliver care much more effectively in real time. The remote monitoring application is a really good example of this, where we're constantly checking in on people at home in care homes, and we demonstrated through a proper evaluation that we reduced the numbers of people in the programme turning up in our emergency departments by 50%.
We support families that are struggling, but as a voluntary organisation we're not on the same systems, we don't have access, so the CIPHA data enables us to identify those families with complex needs who are accessing a lot of services, a lot of health appointments, so that support goes into those families much sooner.
Using the CIPHA data, what our sector can do is take that patient cohort that are there for other than medical reasons and help and support them. Somebody who's just lost their job and depressed, the answer isn't to put them on medicine. The answer is to help them get a new job, to help them get confidence again. So we can actually start to target people and help prevent them getting into crisis to make sure that they're not leading miserable lives and that they're not actually costing the system a lot of money.
Developed over 25 years, CIPHA is a proven care system platform embedded in patient care pathways across nearly 30% of England.
We have thousands of care professionals who are all used to using the shared record and the population health analytics with thousands and thousands of hours of use.
Using the CIPHA data is a game changer for our sector if we're taken seriously and if it's resourced.
As soon as someone turns up in an acute hospital, everything gets expensive. If through shared care records we can get to prevention, there's a game-changing opportunity that we've got. Data saves lives.
If we could get the central funding started to create that focus on connecting the infrastructure, I think the benefits would be realised within 12 months.
The system we've got works so well, so why don't we just continue and make it bigger and bigger and bigger?
Well, my message to policymakers would be, please can we have a shared record? Thank you.